Hey guys, Dr. Anderson here, and I want to do something a little different today. I'm going to talk to you about restless legs and kind of take you through a journey, if you will, of questions that I think you should ask and kind of things that I ask. And there's so many things about what I do that nowadays just seems like, well, of course, restless legs is the cause can be in your legs. I mean, that's where your symptoms lie. So why else do we have to worry about anything else? I mean, there's other things that are out there that you're going to hear a lot about, but I'm going to kind of dissect this out. I'm not sure how this is going to work, but we're going to give it a try just to go through the mental, maybe what I'm saying is the mental wrestling that people might go through to try to figure out why this can work. And maybe one of the reasons I'm doing this is we had a patient again this week from out of state, back from the East Coast. She came in and I saw her 2 days after surgery. Interesting because she has to fly back and then she's going to come back next week and do her other leg. But she's already like 95% improved. This lady's a nurse, she's in healthcare. And I always respect those people a lot in terms of when they come into me for restless legs because they've really scrutinized me. And they've got a critical mind. They've evaluated the idea. And I think they feel comfortable about it. They really get it. And for some of you out there, that may not be you. And it's kind of those of you out there that I'm trying to reach because to come here takes a pretty major shift. When you come to see me, you're not going to hear a lot about this in mainstream media or mainstream medicine. And if you think about it, there's reasons why. Maybe we'll get into that as I kind of tumble through this exercise of going through this whole thing, but just realize that. And for others, they hear and understand what I'm trying to teach them about the restless legs, and they get it right away. I mean, some people within maybe hours or the next day, they're ready to come here. They really understand it. And so let me kind of go through some things and see how this works for you all. One of the things that you're going to hear a lot about is dopamine levels. And we know dopamine is a neurotransmitter in the brain, and it seems like when dopamine levels are lower, that may make you more likely to have your restless legs. And so they've even done MRI imaging and people with restless legs, and some of those studies are kind of a little inconclusive. Some would debate about the brain being a little bit different. But let's back, I don't want to go into a lot of detail about dopamine necessarily, but just think of that concept, just generally. I'm talking about something in the central nervous system, the brain. I mean, I understand the brain affects things, in your legs and your arms, for sure. But it seems a little bit detached. And when you understand this and dive into it deeper, there's not a lot of really solid, conclusive evidence that what's exactly going on. And I'm not denying it doesn't work. I'm saying, yeah, it does work for many people, and it can be a blessing for a lot of you out there. But again, these symptoms tend to be from the knee down. And how does that interplay with the legs? I might also challenge you, when you go see a neurologist, family doctor, whomever, how many of them have laid hands on your legs? How many of them have done a good neurological exam of your legs? Why aren't they looking there? Why aren't they examining how much sensation you have? Why aren't they seeing if you have compression in your legs? Why aren't they checking muscle strength? That in itself tells you a lot. Tells you that they're not really looking because mainstream medicine's not looking at that. So those are other things. So once I get on here and I explain how it can be from compression in the legs, a lot of people are like, holy cow, this kind of does make sense. I'll give you another example. This is what we call anecdotal, not based upon science too much, but it just leads to the belief that this can be in your legs. I was recently at a meeting, and there's physical therapists there. It's more of a business meeting and kind of a mastermind group. And I explained what I do, and they were like fascinated because they have noted in their clinics when they do physical therapy, people with restless legs have kind of sensitivity in certain areas of their legs. And these areas of sensitivity, guess what, guys? They're exactly where many of these tunnels are. So when I brought up the tunnels, they were like, wow, that's amazing. I was wondering about that. They really are curious about this as an idea for a reversal of it. They've even done things like deep massage, or maybe they try to break up the fascial layers. So the fascial layers are the layers that I'm opening when I'm decompressing these nerve tunnels. And by maybe stretching that area, or maybe doing some deep massage to free up the fascia a little bit, they found that it has some help, although it's usually not very long term, but they have seen patients respond favorably. So there again, I'm hearing that from physical therapists, another set of eyes looking at this and going, wow, this is all coming together now. Another example would be people maybe have had venous insufficiency, venous problems, where they're having difficulty getting blood back up to the heart. As it goes down through the arteries to the feet, goes up to the heart, from returning up to the heart through the venous system. And sometimes venous procedures can help these patients. Again, that's another thing that's being done in the legs. And again, it's helping them maybe to a point. And I think that what I do is I'm not only helping the return of blood flow to the heart by getting rid of pressure on the veins, but I'm also getting rid of pressure on the nerves. Something that you may not be aware of, we have a second paper we've been trying to get published now, and in it we have intraoperative neuromonitoring. What does that mean? We've tested the nerve tunnel, or the nerve I should say, before the tunnel's open, and we tested again afterwards. Again, that study, hopefully it's going to get published soon, will show you there's objective evidence of this. And not only that, just patients reporting subjectively, just saying how much better they are. And we've been doing this now for probably about 11 years. So other people will also say things like, well, you know what, I've got some tingling and my burning in my feet and my legs, and thereby that is another example. Like, well, does dopamine affect burning and tingling in your legs? I don't know. Maybe it does, maybe it doesn't, but that corresponds to neuropathy. And if you believe what I believe from my training back with Dr. Lee Dellin over 20 years ago at the Johns Hopkins neurosurgeon, plastic surgeon that kind of mentored me on most of this, well, those are symptoms of neuropathy. And if you think neuropathy is not curable, no, it's not. It is totally untrue. We are able to reverse the symptoms of neuropathy, whether it's diabetic or non-diabetic, by opening up nerve tunnels. And some of you that have restless legs have a portion of your symptoms that aren't just the cramping and the jerking and the restlessness, but can also be the burning, tingling, and numbness. So again, more information. These are things that you should be questioning about, like really trying to understand this. So the other thing would be iron. Iron's another thing. Iron, yeah, that can affect your nerve health. Again, I don't want to go into a lot of depth with this, but when women have anemia, again, that shows or tends to pop up on the radar that they may have more restless legs. And maybe that has to do with nerve health. I don't have all the answers with that, but it's another indirect thing that doctors will do to try to help you. And of course, don't forget, you've got big pharma with billions of dollars trying to make a lot of money, and a lot of the ideas around restless legs are kind of things that can help promote that you taking something that can be monetized for making money for somebody else, or for the doctors to be dispensing these. So trying to think what else I can talk about real quick. And the other thing I would say, not everybody, but the majority of you have symptoms from the knee down. Well, guess what? That's exactly where the nerve tunnels correspond. And some of you, when I talk to you, you're going to even say, you almost point to the nerve tunnel area and say, man, this area kind of bothers me. Or I get massages sometimes, and it's really sensitive when they're poking around or pressing in that area, and you just think it's normal. It is not normal. That's a sign of compression in the nerve tunnel area. And so those are some other things that I think you should question as you go through this, and just kind of wondering in your mind, well, so many things that are, whether it's a musculoskeletal thing, a bone, a joint, or muscle. I mean, the pain is where the problem is, right? And when it comes to nerve, we're all being trained that, oh, no, that's from your back. It's the back radiating down to the foot. Or maybe it's central nervous system, or something where we can be giving you drugs. Well, that in itself should be kind of challenging. Why can't the nerve issues like restless, I think it's a nerve issue, restless legs, and again, neuropathy, why can't it just be where the problem is, right there directly in the legs and the feet? They don't treat you like that in the arms and the hands, do they? You get symptoms in the arms and the hands, and they look at areas of the hands or the arms where there could be a compression of tight nerve tunnels. So I think that's really about it. Just questions that you should ponder about why you ought to kind of question healthcare and where it's going with restless legs. And also question me for sure, because this is different. I know it's different for a lot of you. Oh, one more thing is I've recently been challenged by patients saying, do I need to do a sleep study and this and that? And yeah, sleep studies, I guess they're okay. And it's really, I don't want to step on toes because, yeah, some of you ought to have it done if you've got sleep apnea and things like that. But if it's for just the purpose of restless legs, it might be a waste of your time because it's kind of silly. People get it done and they're like, yep, you got restless legs. Now what are you going to do about it? And they're like, well, I don't know. Just put you on medication. So they're like, well, that was kind of a wasted step, which it can be sometimes. So, so just be aware of that. Test is not always needing to be done necessarily. So I think that's about it. Maybe enough for today. I just wanted to share things and questions that you need to consider. Please go to our YouTube channel. I got studies on there. On our website, got studies on there, and many testimonials from patients, many videos of me explaining how this can work for you. And because I know it's a big shift, and hopefully we can convey to you that this can work for you. But it all starts, I think, with knowledge, and also just questioning what you're hearing out there. And a lot of you do question that, and I think maybe with the advent of COVID, and now we're past all that, I think more people are beginning to question just things that they heard back then and how that might even correlate to things they're hearing now. They're being a little bit more discerning about things that they hear about in healthcare. And you should. You really, if one more message would be, you really have to be your own advocate in healthcare more than ever now. I think it can be really challenging for you. It's really confusing for you. Because a lot of you don't know where to turn. So hopefully I'm learning, hopefully I'm conveying some trust that you can start to trust me, and I can kind of lead you through this maze of things that are out there regarding to nerve problems in the lower extremity, and show you another way out of the suffering that you're going through. So anyway, thank you for watching. It's a beautiful day here in Colorado. I'm going to get back to my hike. And you make it a good day too. And please subscribe to our YouTube channel. This is Dr. James Anderson. Thank you.